Hello, my name is Alyssa Roach, and I'm going to talk to you today about an exercise-mediated smoking cessation project. Smoking tobacco is among one of the biggest health disparities in the United States. The United States spends nearly $170 billion on medical care to treat smoking diseases such as COPD, cancer, heart disease, and stroke each year. Tobacco use is the leading cause of preventable disease, disability, and death in the United States. Kentucky is one of the leading states in tobacco usage, and our citizens are suffering from its prolonged effects. As an advanced practice nurse, it is our responsibility to provide quality health care to our patients and our communities. Assisting smoking individuals with cessation will only increase the health and wellness of the individual and the community in which they live. The purpose of this project is to utilize an exercise-mediated rather than a pharmacological treatment for smoking cessation. Adults aged 18 to 50 who possess a desire to quit smoking and the motivation to improve their health will be chosen through their primary care office and asked to participate. Research was first conducted to analyze the effectiveness of the intervention in other populations. 4 randomized control trials were analyzed and synthesized and proved that exercise-mediated interventions for smoking cessation were successful. The findings reported in the study by Abrantes et al. Revealed that the intervention group demonstrated much higher percentages of 7-day point prevalence abstinence, as well as continuous abstinence compared to the control group. The findings revealed in the study by Taylor et al. Suggested that a program such as exercise-assisted reduction and then stop could be beneficial in the cessation of smoking. The intervention arm showed a 14% abstinence rate compared to 4% for the control group 4 to 8 weeks following their quit date. Results at week 14 in a study conducted by Propavisis et al. Showed that 40.3% of participants demonstrated continuous smoking abstinence amongst all groups. In a study conducted by Madison et al., the number of cigarettes smoked in the previous 7 days decreased by 95%, as well as a decrease in smoking cigarettes since participant nominated their quit date at 95% in favor of the intervention group. According to the 4 research articles, aerobic exercise has been shown to be an effective aid to the cessation of smoking. The objectives for the project are to decrease the population of cigarette smokers, which will also decrease the incidence of secondhand smoke exposure. Decreasing the withdrawal symptoms associated with smoking cessation is also an objective for the project. The less withdrawal symptoms, the less cravings, and the higher the abstinence rates will be. The intervention method begins through a screening process at the primary care office. Persons who smoke between the age of 18 to 50 will be asked if they have a desire to cease smoking and if they would like to participate in an exercise-based intervention. Once they've been screened for inclusion and exclusion criteria and have agreed to the intervention, the risks and benefits will be explained and consent will be obtained. An appointment will then be scheduled with the nurse practitioner, and during this appointment, the patient will be assessed for their ability to perform moderate intensity exercise through a series of physical therapy assessments while monitoring their heart rate, blood pressure, and oxygen saturation. These assessments will be given by a licensed physical therapist as well as a registered nurse. The patient will then appoint a quit date and be instructed on their new exercise routine. The participant will then visit the primary care office every 2 months where they will be given the Minnesota Withdrawal Scale to assess their nicotine withdrawal symptoms. The patient will also be assessed for smoking using a 7-day point prevalence of their abstinence. They will be asked if they've smoked a cigarette in the last 7 days, and outcomes will be measured as a percentage of abstinence. At each follow-up appointment, they will be seen by the advanced practice nurse, and their progress will be assessed utilizing the 7-day point prevalence as well as the Minnesota Withdrawal Scale. After 1 year, the patient will be given continued abstinence information and continually followed by their primary care physician to assess continued cessation following the intervention. A Gantt chart is provided for a visual aid of the timeline for the intervention. The outcomes for the project will be assessed using the Minnesota Withdrawal Scale and the 7-day point prevalence percentage. The intervention should assist with decreasing the withdrawal symptoms as shown on the withdrawal scale. The patient should show abstinence through the 7-day point prevalence measure. The advanced practice nurse can utilize this exercise-based intervention with smoking populations to assist in their smoking cessation journey. The implementation of a 1-year-long program will set the patients up with the tools they require to succeed following the end of the intervention period. I hope that this presentation will spark discussion on intervention-based programs for smoking cessation in the future. I thank you for listening.